Top 10 indicators of liver impairment that you just cannot afford to ignore. It is important to keep in mind that the treatment of liver illness relies heavily on early detection. Therefore, let's get started and provide you with the knowledge you need to safeguard your liver and your general health. One of the most widely known indications of liver impairment is jaundice, and it's typically hard to ignore. A noticeable yellowing of the skin and the whites of the eyes is one of the defining characteristics of this clinical disease. Have you ever looked in the mirror and realized that the whites of your eyes or your skin have taken on a yellowish hue? The appearance of this discoloration is sometimes the first obvious indication that anything might be amiss with your liver. This condition is known as jaundice. In addition, this condition occurs when a chemical known as bilirubin accumulates in the bloodstream. Bilirubin is a yellow molecule that develops in the normal catabolic route that breaks down heme in red blood cells. Bilirubin, which is a result of old red blood cells, is broken down by the liver, which is responsible for accomplishing this task. Normally, the liver processes bilirubin and excretes it in bile. But when the liver is injured, it can't filter bilirubin adequately, causing it to build and give your skin and eyes that yellow tint. It is possible that this inefficiency is the result of a number of liver disorders, such as hepatitis, cirrhosis, or obstruction of the bile channel. So if you do see any yellowing, it's vital to contact a doctor soon away to receive a clear diagnosis and establish the underlying cause. Ignoring these symptoms can lead to more severe health complications. Early detection is crucial, and rapid medical intervention can make a world of difference. Timely management can help control the illness successfully and prevent future liver damage. Moving on to our next indicator, stomach pain and edema. This is a common symptom that can suggest many underlying health conditions. But when it comes to liver injury, it has some special properties. When it comes to liver injury, the pain is generally persistent and centered in the upper right quadrant, just where your liver lies. This location is directly below your ribcage on the right side, and the discomfort can sometimes extend to your back or shoulder. This discomfort might range from a faint aching to a strong stabbing feeling. It might start off moderate and develop more acute over time, or it could come and go, making it difficult to determine the specific source. You might also suffer bloating, a feeling of fullness even after eating a little meal, or a significant increase in your belly size. This can be very unpleasant and may make it difficult to eat or drink properly. As the liver gets inflamed or damaged, it can press against the surrounding organs and tissues, resulting to pain and discomfort. This pressure can create a variety of sensations, from a persistent dull aching to severe intermittent aches. Additionally, fluid might build up in the abdominal cavity, a condition known as ascites, further contributing to the swelling. Ascites can cause substantial discomfort and may even make it difficult to move or breathe correctly. So if you're suffering persistent abdominal pain, especially in the upper right quadrant, don't dismiss it. It's crucial to get medical guidance to discover the cause and get proper therapy. Early detection and management can make a major difference in managing liver-related disorders. Let's speak about a symptom that's commonly missed but can be a warning flag for liver problems: persistent fatigue. We all feel exhausted from time to time, especially after a long day or a terrible night's sleep. But persistent fatigue is different. It's a chronic, crushing fatigue that doesn't go away with rest. Everyday actions that used to feel effortless could suddenly feel taxing. When the liver isn't functioning properly, it can't adequately eliminate poisons from the blood. These toxins can then build up in the bloodstream and impact other organs, including the brain, leading to sensations of exhaustion and lethargy. So, if you're experiencing persistent, inexplicable weariness that's affecting your everyday life, don't just write it off as stress or being overworked. Moving on to another typical indicator of liver disease, nausea or vomiting. We all suffer these from time to time, frequently owing to something we ate, a stomach ailment, or even motion sickness. But when nausea and vomiting become persistent or repeated, especially without any evident explanation, it's crucial to pay attention. When the liver is injured, it can't perform its activities efficiently, resulting to an accumulation of toxins in the body. This buildup of pollutants can provoke feelings of nausea and possibly lead to vomiting. If you're having persistent or repeated nausea and vomiting, it's vital to seek medical assistance to establish the underlying cause. Don't dismiss these symptoms, as they could be indicative of a more serious underlying issue like liver damage. Have you ever noticed a big decline in your appetite? A feeling that you just can't stomach the concept of food, even your favorite meals? This decrease of appetite, commonly known as anorexia, might be another indicator of liver impairment. The liver serves a critical function in digestion, producing bile, a fluid that helps break down lipids. But when the liver is injured, it can disrupt bile production and your overall digestive process. This disruption can lead to a feeling of fullness, even after eating very little, and a general disinterest in food. If you observe a sudden or inexplicable drop in your appetite, especially if accompanied by other symptoms we've covered, it's vital to talk with your doctor. Let's talk about a symptom that you would not think twice about, but can actually be a warning indication of liver disease: black urine. We all know that the color of our urine can vary based on our hydration levels, but when your urine constantly appears dark brown or tea-colored, It's a clue that something might be awry with your liver. When the liver is injured, it can't filter bilirubin efficiently, causing it to build up in the bloodstream and flow into your urine. This extra bilirubin is what gives your urine that dark brownish tone. So if you observe a persistent change in your urine color, especially if it's typically dark, don't dismiss it. While we're on the topic of bodily fluids, let's move on to another indicator that commonly goes hand in hand with dark urine pale stool. The color of your stool can provide crucial insights into your digestive health, and any substantial changes shouldn't be disregarded. When it comes to liver impairment, pale or clay-colored feces can be a red flag. If there's not enough bile reaching your intestines, your stool can turn pale, clay-colored, or even grayish. So if you detect any strange changes in your stool color, especially if it's chronic, it's vital to seek medical treatment. Let's speak about a symptom that you might not instantly link with liver impairment. Swelling in your legs, ankle, also called as edema. We've all experienced swollen feet or ankles after standing for long periods or during hot weather. But when the swelling is prolonged or inexplicable, it's crucial to get it looked out. When the liver is injured, it can't generate enough albumin, causing fluid to leak from your blood vessels and pool in the surrounding tissues, notably in your legs and ankles. This fluid retention can contribute to swelling, making your legs and ankles appear puffy or swollen. While edema can be caused by a variety of circumstances, persistent or unexplained swelling should always be checked by a healthcare expert. Let's talk about another symptom that can be pretty annoying and often suggests that something's not quite right with your liver: itchy skin. We all encounter periodic itches, whether it's from a mosquito bite or dry skin. But when the itching is continuous, strong, and doesn't seem to have an obvious source, it's crucial to pay attention. When the liver is injured, it can't adequately eliminate waste products and toxins from the circulation. These toxins can then pile up and irritate your skin, resulting to persistent itching. While itchy skin can be caused by a variety of circumstances, persistent and unexplained itching should always be checked by a healthcare provider. Let's talk about a potentially serious indicator of liver disease that you should never overlook: easy bruising or bleeding. This symptom can easily be neglected or confused for something less significant, yet it is a key signal of your liver's condition. The liver plays a critical role in blood clotting, manufacturing proteins that help halt bleeding when you become injured. These proteins are crucial for the clotting process, which avoids excessive blood loss and allows wounds to heal properly. But when the liver is injured, it can't create these clotting factors adequately, making you more prone to bruising and bleeding. This impairment might be attributed to several liver disorders such as cirrhosis, hepatitis, or fatty liver disease. You could find that you bruise quickly, even from tiny bumps or scratches, or that cuts and wounds seem to take longer to stop bleeding. This is because your blood isn't clotting as it should, leading to prolonged bleeding and more obvious bruising. If you see any odd bruising or bleeding, especially if you've never experienced it before or if it's happening more frequently, it's vital to get medical assistance immediately. Early diagnosis and treatment can prevent future liver damage and improve your overall health. This could be a sign of a significant liver disease that requires quick care. Don't disregard these symptoms. Consult with a healthcare expert to get the appropriate testing and procedures. Your liver is necessary for many biological activities, and taking care of it is essential for your well-being. So there you have it, the top 10 indicators of liver impairment you absolutely can't ignore. Your liver is a key organ working diligently to keep you healthy. By detecting these indicators early and receiving medical assistance swiftly, you can offer yourself the greatest possible chance of a favorable outcome. If you're experiencing any of these symptoms, please speak with your doctor to get a proper diagnosis and discuss the best course of action for your unique requirements. Did you find this video helpful and exciting? Here is another video you can watch that's even better. Even if that doesn't interest you, then here's one more. Subscribe and hit the bell icon as well.